Good morning, everybody. Happy Friday. This is Nurse Eunice with Florida Training Academy. And in today's video, we're going to be discussing prioritization and time management for CNAs and PCTs. As we do in each video, we'll give you about 10 seconds to receive your notifications, and we will get started shortly. All right, and good morning, everybody. And so, why is this important topic even important? Because as a CNA or a patient care tech, you're going to juggle multiple tasks, patients. You're going to be working with multiple nurses, and some of those situations are going to be time sensitive. If you don't know how to manage your time, it can lead to delays in care. It can have an increased risk of injury. Excuse me. And of course, you and your team members can become frustrated. So, learning how to prioritize and group your tasks together, we call that cluster care. It improves your safety and your patient satisfaction. And I want to apologize. I have a cold, so I'm working from home, but my voice isn't agreeing with me. So, just give me one moment. All right, so hopefully I can continue. All right, so what's the objectives? By the end of this review, you'll be able to identify which patient care tasks require immediate attention. You're going to hear about Maslow's law whenever you're in nursing school, but it talks about the need of prioritization. It's going to help you understand and apply the concept of cluster care, doing more things when you're in the room so you don't have to keep walking backwards and forward. It's also going to prepare you for your real CNA exam because we are including exam scenarios and real life questions. When you take your CNA examination, it is multiple choice. It will usually not be in a scenario format, but our scenarios are going to help you think through the process. So, what is prioritization? It's deciding which task to do first when several tasks need attention. I want you to think, who is at highest risk of harm? Who needs urgent or scheduled care like therapy or medications? If a patient needs insulin, that means as a CNA, you don't give the insulin, but sometimes you're going to have to do the finger stick. You have to check their blood sugar, which will make that patient a priority. And who can safely wait? Understanding these different topics will help you decide which patient is your priority. What is cluster care? Cluster care is grouping multiple tasks together during one visit to save time. For example, while helping with toileting, you can also check or change the bed linens, offer water if the patient can remain in the bathroom safely. You can assist with hygiene while they're on the toilet. You can run the water, give them a quick sponge bath. You can help reposition them. Let's say you gave them a bedpan. When you're done, go ahead and change their position. This helps to save time and energy, and it keeps your residents comfortable and prevents delays. And for some of you all who are already out there working in the field, as I go through some of the different ways that we can improve patient care and also cluster care together, if you have any tips that I didn't point out, I want you to put those in the comments. So, what are some common pitfalls that CNA face? You all run back and forth to get supplies. You get distracted by loud or demanding residents. So, you'll have one resident who is asking a lot of you, which means you spend so much time with that one resident because you don't know how to prioritize care that you end up neglecting your other residents. You can also ignore subtle signs of emergency like shakiness or confusion. You sometimes forget to report things that are important, and you also forget to document. And we'll address all of these in today's test. All right, so let's get ready. As we do in each of our videos, please put your comments or your answers in the comment area. I'm not going to be able to check the comment as much today because I don't want to get distracted. But go ahead and get pen and paper. Trust your instincts and what you already know, what you've learned so far, and let's get started. Question number one, team. When a resident with diabetes is weak and shaky, A resident with diabetes is weak and shaky. Another resident is calling for help to the bathroom. A third is waiting for their lunch tray. Which should the CNA see first? A, the resident calling for help to the bathroom. B, the resident waiting for lunch. C, the diabetic resident who is weak and shaky. Or D, all residents at the same time, which is going to be impossible unless you can clone yourself. So give you a few seconds to put your answers in the chat. All right, and thank you for your patience. Revealing the correct response in 3, 2, and you're torn between A's and C's. And then, yes, Nini, I have a phlebotomy video, and I will focus on that one next week. But this week, we're all about CNAs. So let's go. I know this one was tricky, everybody, because you want to help the person to the bathroom, but you have a diabetic patient who is shaky. So you're going to go to that diabetic patient first. So signs of low blood sugar, weakness, and shakiness are a medical emergency. You'll assist that resident first, and then you can go back and help the person to the bathroom. Yes, that was an emergency, but it wasn't a medical emergency. All right, question number 2. A CNA is starting their shift and has the following task: a resident who needs a wound dressing change, a resident who is incontinent and lying in a wet bed, a resident who has therapy in 15 minutes, and a resident asking for water. So you need to help the nurse change the dressing. You have somebody who's wet themselves. You have somebody going to therapy, and you have someone calling for water. Who do you see first? Would it be A, would you bring water to the resident? B, would you change the wet bed? C, would you help the nurse do the wound care? Or D, would you prepare the resident for therapy? And then, Game, I do see your comment. If you have a question, go ahead and send it to us via email, because I have a cold and I'm just trying to get through this particular video without talking too much. So if you'll send an email to admin@fltraining.com. All right, everyone, this one is tricky also. Let's see what you say. Let's see. We're all around. We have A's, we have B's, we have C's. You all, for this one, the priority would be the person who has therapy. So if you chose D, and some of you all did, you are right. So therapy has a set schedule. You got to get that person up right away. Go ahead and do whatever you need to with them, so they don't miss their therapy appointment. And then from there, I would probably go back and help the person who is wet. If I can give the patient water, I give them water. It's going to take longer to do that wound care dressing. So I want to make sure I have enough time for the dressing, but the dressing is not a priority. Getting that patient ready for therapy so that they don't miss their appointment would be something that you would want to prioritize. Question 3, a CNA is performing morning care. Which task should be completed first? Is it A, help a resident who is vomiting? B, refill water pitchers? C, change a resident's bed linen? Or D, comb a resident's hair? This one is super easy. Which patient, which task are you going to complete first? And we'll reveal the answer in 5, 4, 3, 2, and that's right, Jonathan and Joy and Josie and Mickey, you have it. Darlene and Tabby, we're going to help that patient who's vomiting. Yep, that's a medical emergency. They're going to be seen first. All right. Question number 4. A resident is due for discharge in 30 minutes, but another resident with dementia has wandered into the hallway and is disoriented. What should the CNA do first? A, prepare the discharge paperwork. B, help the disoriented resident return safely. C, ignore the hallway resident. Or D, take a break before assisting either. And you all get called so much, especially on a 12-hour shift. So who would you focus on if this was the situation? And you have it absolutely correct. Yep, safety is the priority. So the correct response is going to be B. The disoriented resident could fall or leave the unit. So you're going to get them back to safety first. Put that bed alarm on, let the nurse know, hey, he's getting up again. And then you can go take care of the patient who needs to be discharged. Question 5. A CNA walks into a resident's room and finds the oxygen tubing has come off. What should the CNA do? A, call the nurse. B, call the respiratory therapist. C, reattach the tubing immediately. Or D, ask another CNA to help. Ooh, what do you think, team? You're slower with the responses on this one. But I am so proud of you. So many of you all have the correct response. It is revealing in 3, 2, and 1. It's C. Great job. CNAs are trained to replace the oxygen tubing if it's dislodged. So you can put the oxygen back on, you just can't change the rate, the flow rate. So it is an immediate critical task related to breathing. So you're going to put the oxygen back on, or if it's disconnected from the wall unit, you're going to connect it back into the unit. Question 6. A CNA has 5 residents needing morning care. One has a pressure sore. Another is fasting for labs. Another needs to be turned every 2 hours, and 2 are stable. Who should be seen first? The resident with the pressure sore, one of the stable residents, the resident needing repositioning, or the fasting resident. I know this one, you're torn between 2 of the 4. Which one do you want to see first? Revealing the answer in 7, 6, 5. I see some correct responses coming through. All right, revealing the answer now. It was tricky. Jonathan, I see you. It is D. The person with fasting labs. Number 1, you want to make sure they're still fasting, that they didn't go and sneak something to eat or something to drink. So fasting labs mean that the resident hasn't eaten for a set number of hours. That's going to put that patient at risk of hypoglycemia or low blood sugar. And normally the persons who have fasting labs are your diabetics. So this is required for accurate blood test results, especially for glucose, cholesterol, and triglycerides. Why does timing matter? Why can't you just go see the patient who has the pressure sore first? Because if the CNA doesn't help that patient get ready, whatever they need, if that patient's in the bathroom, whenever the lab tech comes, that lab tech will skip them and go and see the other 100 patients in the hospital and then come back to them. So that means your patient will be fasting for longer. So when you're getting your report in the morning, are there any tests that need to be made aware of? Those are the questions that you want to be asking. And they may not tell you about a fasting test, but they're going to tell you who's a diabetic. And you can make your diabetics your priority, especially if you have to check blood sugars or assist somebody to the bathroom who's a diabetic. Question 7, and I want to thank you all for bearing with me while I have this cold. I do apologize. All right, question 7. A resident with Parkinson's disease is trying to get out of bed alone. What is the most appropriate first action? A, tell them to wait. B, guide them back to bed immediately. C, report to the nurse. D, assist them safely to stand or sit with supervision. What do you do? And I'll accept 2 answers for this one. They're trying to get out of bed alone. They're trying to get up. What do you want to do? Revealing the correct response in 3, 2, and yes, but I can see why you also want to choose B. But D is the correct response because they're already standing. So I need you to help them stand safely. Make sure they have their shoes on their feet. And so I'm not necessarily going to put them back in bed because maybe they need to get up and go to the bathroom. So I'm going to make sure I assist them, make sure they have their socks on with the non-skid padding on the bottom or their shoes on, and then assist them to wherever they're trying to go to. It could be something as simple as them trying to go from the bed to the actual chair, but prioritize their safety, and just don't put them back in bed, because if they're trying to get up, they're just going to get up again when you're not looking. Question 8. During shift change, which resident should a CNA see first? A resident asking for lotion, a resident who hasn't had a bowel movement in 3 days, a resident who just returned from surgery, or a resident asking about lunch choices? Oh, which one do you see first? I like this question. All right, I'm looking at the responses coming through. Katie chose 2 answers. All right, everybody. Everybody had the correct response. It is, it's C. Your post-op patient is going to be your priority. They are at risk of blood loss. So usually whenever you have a patient who comes back after a surgery, one of the first things you're going to do as the patient care tech or CNA, wherever you're working, is you're going to get a set of vital signs. And so, yes, you're in the room with the nurse, but I have my assessment and you're assisting with the assessment by putting that blood pressure cuff on, making sure they have the pulse ox or the oxygen meter reading device that'll be placed on their finger. And so that would be your priority. Then you can go help the person with their food choices and then go help those other patients. But we're going to see this patient first. All right. And so for you all who like to listen on the go, we do have our new podcast. We'll also be adding our recordings to Spotify. But right now our podcast is on YouTube, and the website is youtube.com/the @ Florida Training / podcast. So you can listen on the go and keep studying for your examinations. Question number 9. A resident accidentally spills water all over the floor. What should the CNA do next? A, finish the current task, then return. B, call housekeeping to clean it now. C, wipe it immediately. Or D, ask housekeeping to clean it later. And everyone has this one right. Great job, team. It is C. Wet floors are a hazard. You're not going to put that off for someone else to do. You're going to go ahead and clean it up, put a towel on the floor, and if you have your wet floor sign, also place that out too. Question 10. A CNA receives a resident assignment that includes someone on fall precautions, one who needs feeding, and another who's alert and independent. Who should it on first? One's on fall precautions and one who needs to be fed, and there are 2 who are alert and independent. Do you see whichever's room is closest? Or B, the one needing assistance with feeding? C, the alert and independent resident? Or D, the resident on fall precautions? All right, waiting for some more answers to come through. Revealing the answer in 3, 2, and you all, safety first. Don't go see the independent people first. You can go see them after you check on the person who's on fall precautions, and then go feed the patient who needs to be fed. Remember, the independent people, as long as dietary actually puts the tray in their room, they can sit themselves up, they can feed themselves. But the one who's on fall precautions, at least just go in and look to make sure they're where you left them, that they don't have any needs, that they have their call button nearby. And then, that's all you're doing is just checking on their safety. Question 11. A resident starts coughing and choking while eating. Another resident is asking to be toileted. What should the CNA do first? A, toilet the second resident. B, call the nurse. C, stay with the choking resident and perform interventions. or D, finish your current task and come back. So, in some of your hospitals, you're going to have 10 to 12 patients on day shift, depending on the unit that you work. In some nursing homes, you can have 15 or more patients. So, it's a lot of knowing how to prioritize your care and how to manage your time. But right now, if someone's choking, that's your emergency. You're going to do C. You're going to stay with them. And if you have to perform the abdominal thrust, you will. And of course, you'll be calling your nurse. So the other patient who's asking for help will have to wait because you have to take care of the emergency first. Question 12. Which of the following tasks should be completed last during your shift? A, assisting a resident with toileting. B, straightening linen in an unoccupied bed. C, changing a soiled brief. Or D, answering a call light. Which is the least important? Which is the one that you would do last? And yes, 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 team, that is the right answer. So if you chose, there we go, B, you have it. That has no priority. An unoccupied or an empty bed, joking and laughing, someone maybe sat on the bed, the sheet isn't the best, you're going to go in, you're going to straighten everything out. But that room doesn't even have a patient. So that is the last thing you would do at the end of your shift. That is not a priority. Question 13. You enter a room where the resident's bed alarm is sounding. What should you do? A, silence the alarm and walk away. B, call the nurse to help. C, call housekeeping. Or D, enter the room to check on the resident. And I expect 100% of you to get this response right. Revealing the answer in 5, 4, 3, 2, and yes, Carmina and Catherine and Christine and May and Darlene, that's a lot of you all, and Katie and Lucy, you have it right. It is D. And so I chose this photo as a reminder that as a CNA or a patient care tech, you can work anywhere that a nurse works, which includes the children's hospitals. So if you hear an alarm sounding, regardless of what unit you're working on, the bed of somebody who shouldn't be getting out of bed is getting out of bed without your assistance. So I'm going to call her Cindy. I need for you to put little Cindy back in the bed or help her to the bathroom because we don't want someone trying to get out of bed with their IV pole and their IV tubing and their catheters. We have you there for a reason so that you can assist them safely. Question number 14. Which task is the lowest priority? A, turning a resident who is on a turning schedule. B, helping a resident who needs help getting to the toilet. C, offering a drink to a well-hydrated patient or resident. Or D, assisting with morning oral care, which is the lowest priority. Yes, and everyone answered that one correctly. It is C. Offering fluids to someone who's already well hydrated is not an urgent matter, but repositioning a patient and helping somebody with toileting would be the priorities. Question 15. You're behind schedule, as you're going to be a lot of days, and a resident complains that their roommate is in pain. What do? A, notify the nurse immediately. B, finish your assigned task first. C, ignore it. It's not your assigned resident. D, tell the resident to press their call light. Leonie, I'm seeing your answers now. Miss Bonita, no. That is not the correct response. Yes, Leonie and Jonathan and Gladys and Carmina, you're right. You're going to get that nurse in the room. So everybody's your patient, whether you're assigned to them or not. And so if a patient who is in your facility, if someone notifies you, you have to go let that nurse know. So pain should always be reported promptly, regardless of whether or not the resident is assigned to your care. Acting quickly ensures comfort and safety. And Birth, I am so proud of you. Congratulations, my dear. What a way to start the month of April. All right, question 17. I'm sorry, question 16. Which of these residents should assist first during morning rounds? A resident who needs to be dressed for a family visit. C, a resident who wants to shave before breakfast. Or D, a resident who is requesting a TV channel change. Who do you see first during your morning rounds? And I'm curious, based on what city or state you're in, do you know how many patients a CNA or a patient care tech will receive in your area? Because again, ours is 10 to 12 on morning shift at hospitals, and upwards of 20 at some of the nursing homes. All right, revealing the answer in 3, 2, and yes, you are right. It is B. Incontinence can lead to skin breakdown. You're not going to be leaving your patient wet while this person's hygiene first, and then you can go back and care for the others. Question 17. The nurse up. What should you do? A, set up the room quickly. B, ask another CNA to help while you finish your task. C, tell the nurse you're busy. D, help the resident who is calling out. Oh, this one, because I know you don't want to disappoint anybody, but can you do everything? Ashmouth said, look, I'm just going to finish setting up this room quickly. All right, so we have all the alphabet for this one. We have A, B, C, and D. All right, and so I don't think I have the correct response there, but you're going to help the resident who is calling out. Okay, so go and help them. That is the priority, and then you always can go back and finish setting up that room. And don't be afraid to ask a nurse or a CNA for help, and they can help you prioritize. Your nurse will be able to tell you, well, this patient isn't coming to the room until 15 minutes from now, versus somebody coming from the ICU or ER. And sometimes they're like pushing the patient down the hall as you're setting up the room. But hopefully your nurse has told you in enough time to where you could go and assist your other patient and then return and set up the room for a new admission. Question 18. You are assisting a resident with bathing when your teammate, another CNA, urgently asks for help transferring a heavy resident who is unable to bear weight. That means this resident can't stand on their legs. They can't bear weight. What should you do? A, continue bathing your resident and help when you're done. B, ignore the request and tell them to ask someone else. C, ensure your resident is safe and covered, then assist your teammate. D, tell your nurse that your teammate is interrupting your work. Oh, Lord, please don't do D. We're called a team for a reason. We help each other out. And so, yes, you have it correct. It is C. We're going to help each other out. So the teamwork, it involves supporting one another to maintain patient safety. And that bath was not urgent. So you can cover your patient and you can reheat your water when you return and resume your bath. But that patient who is struggling to get into bed right now, your teammate needs your help, that patient's going to be a fall risk. So please go and help your teammate get that person who can't bear weight back into the bed. Question 19. During a busy shift, how should a CNA prioritize tasks? A, based on the order the tasks were assigned. B, based on the resident who complains the most. C, by starting with the easiest task first. Or D, based on urgency and resident safety. I know what you want to do. You just want to go in order all the way down the hall from room 1 through 20. But it doesn't happen like that. You have to base your care upon D. Yes, upon the urgency and the safety of those individuals. Okay, so if room 20 is already calling you and you just walked into the building, but that's the one who is asking to go to the bathroom, that's the person you're going to see first, especially if the other call lights are not on. Question 20. Your unit is short staffed and everyone is busy. A resident needs help getting to the bathroom, but you're currently helping someone else. What is the best course of action? A, ask a teammate if they can assist the resident right away. B, finish your current task and then assist the resident. C, tell the resident to wait until shift change. D, skip your current task to help the other resident. And I think I've really drilled this in, so everyone's going to get this answer correct. Yes, Catherine and Jonathan. You have team members ask for help. So effective prioritization includes All right, everybody, I think we are back, and I apologize. I will shoot this video again at another time for those of you all who have already been here with us. I just want to continue where we were, and I think we were on question 13. So thank you for your patience. Computer just totally cut off, a computer that had already been restarted, so I'm not sure what happened, but we are back. Up, still no sound. Oh, no. Oh, Priya says she can hear me. So is there anyone else who cannot hear me? Okay. Whew. Thank you all. I am so sorry. When things like this happen, I say there must be an alien spacecraft overhead that's causing me to have technical issues. But all right, let's go back to where we were. Thank you so much. Thank you all for your patience. I love you all so much. All right, so I think we're on question 17. So let's start there. We've done that one too. We completed a lot. And again, I will go back and create this whole video over again so we don't have so many interruptions. But for those of you all who are here now, I just want to make sure that you get the rest of the video. So thank you, thank you, thank you. All right, so here we go. All right, so question 21. You just started your shift and received report on the following residents. Let me make this larger. Mr. Jones is on fall precautions. Miss Carter is requesting to be toileted. Mr. Lopez needs assistance getting to the dining room. Miss Fields needs help brushing her hair. And let me just add the second slide. Who should you see first? Would it be Miss Carter, Mr. Jones, Miss Fields, or Mr. Lopez? So let's go back and look at them again. Miss Jones, Mr. Jones is on fall precautions. Miss Carter is requesting to be toileted. Mr. Lopez needs assistance getting to the dining room, and Miss Fields needs help brushing her hair. Yep, it's going to be Mr. Jones. Just make sure he's safe. Go ahead and check in on him really quickly. Give him his call bell, and then you can go and help the other one. I think Mrs. One of them need to be toileted. You can go to her next. Question 22. You walk into a resident's room and find them on the floor, alert but unable to get up. What should you do first? A, help them up immediately. B, report it to the nurse. C, check for breathing and injuries, then call for help. D, leave the room to find another CNA. I love it. Yes, that's the correct response. It is C. So you're not going to get that person up by yourself. When you're doing your assessment, if the person was previously talking to you, you're still going to stay there with them just in case that patient fell due to low blood pressure or as a precursor to cardiac arrest. So yes, you're going to stay with them, check for breathing, and you would probably, if the person did stop breathing and they no longer had a pulse, you'd be starting CPR before your nurse arrived to that room. But under no circumstances would you leave them if they're on the floor. You stay with them, you press that code button, you scream for help, and you're right there by their side. You could be asking them about their pain. Do they hurt anywhere? But you can't really do anything about it until that nursing team gets there. Question 23. A resident with a colostomy bag has dried leakage on their gown and bedding. Another resident is waiting to be fed. And a third is a stable patient who needs a routine bath. What is the best course of action? A, feed the resident first. B, notify housekeeping to assist with the mess. C, bathe the stable patient first to get it out the way. Or D, change the bedding and the gown of the patient with the colostomy bag. Who would be your priority? I'm so proud of you all. That's right. Don't leave that patient lying in fecal matter. So the one that you're going to see first is going to be D. Addressing the leakage prevents skin irritation and preserves dignity. And possibly the reason why it was dried was maybe the wound care nurse or the ostomy nurse, they came in and they provided the wound care or ostomy care, but they're not going to give you a bath. They're just going to make sure there is a good wafer, a good appliance on that's intact. And then it's going to be up to you to do everything else. So you're going to take care of them and then go address your other patients. Question 24. You are feeding a resident when the call light in the next room begins flashing. What should you do? A, ignore it until you're finished feeding the resident. B, stop feeding immediately and leave. C, ask another CNA to respond if available. D, turn off the call lights remotely. Well, if you're able to do D, you're probably going to be on the news soon for patient neglect. So we're not turning off call lights without addressing the resident's needs. So with that in mind, the correct response is going to be C. That's right, Frederick. See if there's someone else who can help you, because you don't want to leave this patient alone who's at risk of aspiration in order to go answer the call light unless you have no other choice. So resident safety must be maintained. If you're assisting someone with eating, ask for help instead of abandoning the task or ignoring the other resident. Question 25. During evening care, a resident who usually needs full assistance with toileting is trying to get up by themselves. What should you do? A, allow them to try for independence. B, redirect them gently and assist with toileting. C, tell them to sit and wait. D, tell the nurse to handle it. Just like you don't like being told what to do, nurses don't like being told what to do either. So we try to keep a friendly tone and we ask. All right, so of course the answer is not D. Revealing the correct response in 3, 2, and if you chose B as in boy, you have it. The resident has risk of falling, so you can assist immediately while encouraging safe independence. So question 26. You are in the middle of assisting a resident with feeding when the nurse asks you to immediately help move a patient who is being discharged. What is the best response? A, leave the resident and go help the nurse right away. B, say no and continue feeding without explanation. C, tell the nurse to ask another CNA. D, ask the nurse if it can wait until you are finished feeding. The nurse doesn't know what you're doing every single minute. And a lot of your facilities, we have in-house phones, cell phones that we will use. We will call you, we will page you. And so you're being notified while you're doing task A about task B. What do you think the best response is going to be? Revealing the answer in 3, 2, and that is right. We're going to communicate. It is going to be D. You're going to communicate professionally. Since the feeding is the priority, you're going to ask that nurse if the discharge can wait. And if the discharge cannot wait, your next question is, well, can you come in and finish feeding this resident so I can go and discharge this patient? So sometimes your nurse has to help you do those tasks, especially if she is adding additional tasks. I don't want you trying to overwhelm yourself. You cannot be everywhere at once. And so either she's going to get someone to assist you or she's going to be the one coming into the room if the discharge is that important. Question 27. Your supervisor asks you to help train a new CNA, but you're behind on your own task. What's the best response? And don't train people if you have attitude. Just don't. Tell your boss that today isn't the best day for you to have a mentor, a new CNA with you. So are you going to do A, refuse to help because you're too busy? B, say yes, then complain to your coworkers later. They always be having me train people. C, help the new CNA but rush through your other task. Or D, let your supervisor know your current workload and ask for guidance on priorities. And if you think about it, you precepting, you assisting a new CNA, you can not only show her the ropes or him the ropes, but you would also have somebody there to help you change the beds, to give the bath. So you're not just talking, you're actually having them work too. So with that in mind, your correct response is going to be D, not C. You're going to communicate with your supervisor and let them know that, hey, I know I'm really busy, but if you want this person to work with me, let me know what the priorities are. What skills must they see so I know what patients to go to first? Question 28. You're in the middle of restocking supplies when the nurse asks you to sit with a confused resident who is in restraints until the sitter arrives. The resident has been trying to get out of the bed and remove the restraints. What is the best action? So you are usually busy on the floor. Today, you're sitting one-on-one with a confused patient. What do you want to do? A, finish restocking supplies first so you don't forget. B, sit with the resident immediately and ensure their safety. C, tell the nurse you're busy and we'll go do it later. Or D, ask another CNA to do it even if they are with a patient. Yep, couldn't trick a one of you. You knew the answer was B. The confused resident and restraints requires immediate supervision. And so you're going to stop what you're doing and you're going to go sit with that resident. Question 29, you're sitting with that resident. And so while you're sitting with a confused resident in restraints, the patient becomes agitated, starts cursing at you, and demands to be released to use the bathroom. The resident says, take off these damn things. I need to go to the bathroom now. If you are the CNA sitting in that room, what should you do? A, ask the nurse when is the sitter arriving. B, immediately remove the restraint so the resident can go to the bathroom. C, walk away and let the nurse handle it. D, argue with the resident and tell them to stop being rude. C, calmly reassure the resident, notify the nurse, and stay with them until assistance arrives. And this is going to happen. It's going to happen. You're going to get that confused person who is not saying nice things to you. Yes, you have it right. Revealing the correct response in 3, 2, and 1. Please don't remove those restraints when you're in the room by yourself. Your safety is a priority. So it is going to be E. You're going to have to reassure them until that nurse gets into the room. And then we can talk about the toileting, different ways where they can use the bathroom, whether that's going to be giving them a bedpan or giving them a urinal. If it's a female, maybe if there's other medical concerns, or male, your nurse can actually get an order for a urinary catheter. But under no circumstances would you release those restraints without a doctor's order. All right. Question 30. A CNA records the following vital signs: temperature 98.6, pulse 104 beats per minute, respirations 18 per minute, blood pressure 180 over 100 millimeters of mercury, pain level 2. What should the CNA do first? A, document all vitals and check on the next resident. B, report the elevated pulse to the nurse. C, report the elevated blood pressure to the nurse. Or D, offer the resident a glass of water. I'm going to let you go back and look at the vital signs. Which are you reporting to the nurse? if anything? Yes, everybody. It is going to be C, that the pulse was just slightly elevated. That's not an emergency. But that blood pressure of 180 over 100 is considered a hypertensive crisis. And so, especially if that patient has a history of heart disease, you want to let that nurse be made aware right away. And then you could tell her about the rest of the vital signs. The blood pressure was the priority. Question 31. You're helping a resident with grooming when another resident begins to have a seizure. What should you do first? A, continue grooming the first resident. B, rush to grab the nurse. C, call a code blue. D, ensure the safety of the resident having a seizure. Ooh, this one's tricky. What do? They're having a seizure. We are torn between C's and D's. Ooh. It's almost even. Leone keeps putting E, so I'm not sure if he's looking at the previous question or not. But all right, everybody, revealing the answer in 3, 2, and a code blue is only for people who are turning blue, people in cardiac arrest or respiratory arrest. So you would not call a code blue for a seizure. So the answer is D. Seizures are emergencies. Whenever you're trying to protect the patient from harm, you're making sure they're not hitting side rails, that they don't hit their head on anything. So you're going to ensure their safety by moving objects out of the way and putting something soft under their head. While seizures are a medical emergency, it's not the same type of an emergency as a patient who is pulseless or somebody who's not breathing. So for a seizure, you're pressing the call, you're pressing the code button to get the nurse into the room, but it's not going to be a whole floor page where it says like code blue and you get a whole code team in the room so we can start CPR. So those are two different levels of emergencies. I hope you understand that. Question 32. During rounds, you notice that a resident with dementia has taken off their brief and smeared feces on the wall. Another resident is ready for their shower. What do you do if you're the CNA? A, clean and redress the soiled resident. B, ask housekeeping to clean the mess. C, shower the waiting resident. Or D, ignore it and keep working. Your resident with dementia decided to do finger paints with his body excrement. So there is brown substances on the wall. He no longer has on a diaper. Or an incontinent brief is the correct term. What do you want to do? Revealing the answer in 3, 2, and that's right, Vanessa. It is A. And I've only had this happen one time. But I'm going to advise you to either keep extra uniforms in your locker or in your bag if you don't have a locker. If you don't have an extra uniform, I'm going to ask that you go down to the OR. Usually the OR, they have extra scrubs, those green scrubs. And of course, you're going to gown up and glove up because you don't want to get any excrement, any fecal matter on your uniform when you're doing this because it can be quite messy. You would focus on the patient and you would clean as much of the fecal matter off of the wall as you can, but the rest of the residue have to be cleaned by environmental services. A lot of your facilities don't allow you to call them housekeepers. We'll call environmental services in to clean up the rest. Question 33. A resident with dysphagia is coughing and appears frightened during mealtime. Another resident is waiting to be transferred to bed. What is the CNA's priority? Is it A, transfer the other resident? B, stay with the dysphagia resident and monitor closely? C, grab water for the coughing resident? Or D, ask a coworker to take over? And I'm so proud of you all for studying on a Friday. Again, I apologize for the technical issues. That has never happened before. So hopefully that won't happen again. But revealing the answer in 3, 2, and the correct response is B. The resident was swallowing difficulties because they're at a higher risk for choking. You're going to stay with her and monitor her, limit those distractions, making sure she's sitting upright. And if she is required to have thickener or any special consistency fluids, making sure you add the thickener to it so that she can swallow safely. Question 34. A CNA was just verbally assaulted by a confused and aggressive resident. The resident yelled profanities, called her names, and even threatened her. Although she didn't respond at the moment, the experience left her feeling shaken and hurt. Later, she notices that she's being short tempered, cold, and impatient with her other assigned residents, even those who are calm and kind. She realizes she's taking her frustration out on them. What is the CNA's best action? A, keep working and ignore her feelings because the residents come first. B, ask to leave work early without explanation. C, take a short break after notifying her supervisor to regroup and calm down. D, continue acting distant because the other residents will understand she had a tough morning. So when you're thinking about prioritization, you're usually thinking about the needs of the patient. I just told you, you're going to have 12 patients in some facilities, 20 patients in others. I need you to prioritize your self-care and your well-being also. So if you're having a bad day, take a freaking break. Yes, it is C. So take a brief, intentional break after informing the supervisor. Hey, Eunice, this patient just cussed me out. I need a moment to breathe. I'm going to step outside for about 15 minutes and I'm going to say, okay. All right. So this approach prioritizes both self-care and patient dignity. If you ignore the emotions, you're going to blow up on someone else. And if you don't do it at the facility, you're going to take it home and you're going to blow up on your own family member. So take time for yourself to process what you had just experienced. Question 35. A resident just received a new cast on their leg and is complaining of numbness and tightness. What should you do? A, notify the nurse immediately. B, elevate the leg and remind the patient to wiggle his toes. C, chart the complaint at the end of your shift. D, tell them the tightness is normal. So what do you know about cast care after a patient has a fractured or broken joint or bone and there's a cast placed? Would it be A, B, C, or D? And yes, if you chose A, you understand that that extremity can still swell, especially when that cast is applied. And so if it continues swelling to a certain point, that patient can lose blood flow to that extremity. So you're going to report it to the nurse because numbness and tightness in a cast could indicate circulation issues. Question 36. You are bathing a resident when the fire alarm sounds. What is your immediate action? A, finish the bath quickly. B, ignore it. It's probably a drill. C, get the resident dressed and evacuate per protocol. D, leave the resident and evacuate yourself. I see a lot of correct answers coming through. That means you understand what to do in a fire emergency. It is C, safety first. When there's a fire, we are going to race. And RACE stands for rescue. Move those patients out of harm. A is alert. After you move your patient out of harm, you're going to either pull the fire, you want to pull the fire alarm, or if you're in a facility where, let's say you're in home care, you're going to be calling 911. That's how you're going to alert or alarm. C is confined. Most of the doors in your facilities will have a fire rating. So if you close the door, it can be hours before fire can penetrate that door. So R is race, A is alarm or alert, C is confined, and E would be extinguish the fire if you have a fire extinguisher that's capable of extinguishing a fire. Because if it's large, you need to do the other E, which is evacuate. So that is what you would do during a fire in your facility or a fire at a patient's home. Question 37. You're assigned 5 patients. Who should be checked first? A, one asking to have their hair combed. B, one showing signs of shortness of breath. C, one who needs a snack. D, oh, I put it twice. That's how important that was. I added it twice. So the correct response is going to be B or D, shortness of breath, because it's a serious symptom that may indicate a respiratory emergency. And you're not acting in the role of a nurse, but you're in the room with that patient until the nurse arrives. So what position do you put the patient in? Are you just going to let them lay flat if they're short of breath? Those are some of the other prioritization, the other steps that you need to know as a CNA, because if it takes your nurse 2 minutes to get into the room, you don't want your patient struggling to breathe the whole time. So you would sit them up, tell them to take some deep breaths in and out, and then just check their oxygen, because sometimes the tubing could be disconnected or they don't have their oxygen device on at all. And so you can put that on them. And if you have time also without leaving the room, you would do a full set of vital signs. Question 38. A CNA has a full load of residents. One resident is at risk for elopement and is currently unaccounted for. What should be done first? A, alert the nurse and follow the elopement process or protocol. B, finish feeding the other residents. C, search the hallways and nearby exits. D, wait to see if they return. And this one should be easy for you. Revealing the answer in 3, 2, and it is important for you all to do A. You have to alert that nurse if your patients are unaccounted for. 95% of the time is something easy. They went to x-ray. They went to another procedure area. Maybe they had a test that day that required them to not be in the room. But you need to ask, because earlier this year, a nurse went to jail and her response was, but I'm a new nurse. I'm a new nurse. She went to jail because her patient was unaccounted for. And I'm assuming the CNA never asked about the patient either. They found the patient frozen outside. Somehow the patient had gotten outside and they didn't even call the code yellow, the elopement, so we can start searching the facility until the following morning during shift change. So that patient had been missing for a whole 12 hours, but the nurse was still documenting that the patient was in the room safe when she was doing her rounds. So if your patient is unaccounted for, please go ask that nurse. And if you have a gut feeling that something's not right, you can activate a code. All right, let's go to our next one. I know that's horrible. Question 39. A CNA is assigned to a resident who constantly makes inappropriate sexual comments. During morning care, the resident tries to touch the CNA's lower back. What should the CNA do? A, laugh it off to avoid confrontation. B, ignore it and finish care quickly. C, calmly redirect the resident, maintain personal space, and report the incident to the nurse. D, yell at the resident to stop touching her. And everybody got it right. And so what I am starting to do is I am implementing real situations that are currently in nursing news. And I'm going to be including those in our patient scenarios, because there was a patient who kept touching the CNA. And although the CNA told the patient to stop and told the nurse, They didn't change her assignment, and the patient touched the CNA again. The CNA grabbed the patient's hand, allegedly, just grabbed his hand. The charge nurse got involved, called the police, and now that CNA is charged with a felony for assault, for grabbing the hand of a person who kept touching her inappropriately. So you are not going to be abused on Miss Nurse Eunice's shift. If something isn't right, you can request to have a different patient. If that nurse isn't giving you a different patient, go above her and go to the charge nurse. But you should not be abused. And if you, now we know this, if you touch a patient's hand when they're grabbing you, you could possibly be charged with assault. So keep that in mind. You're going to let that patient know that that's not going to be tolerated. You're going to let the nurse know you don't feel comfortable. And if that nurse doesn't go in there and speak to that patient with you in their presence, that's probably not the best place for you to work, because your nursing team isn't supportive of you and your needs as a CNA. All right, question number 40. A resident has an elevated temperature and is shivering. Another needs their hair combed for visiting hours. What's your next step? A, comb the resident's hair. B, offer a blanket and return later. C, take a lunch break and reassess after. Or D, report the fever to the nurse. And I wouldn't expect anything less. Each of you answered the question correctly. They had an elevated temperature, aka a fever. You're going to make the nurse aware. So it's going to be D, because a fever may indicate infection, plus this person shivering. So get them comfortable first, recheck those vital signs if you need to, let that nurse be made aware, and then you can go take care of your other patients. Question 41. A CNA is about to assist a resident to the bathroom. What is the best example of cluster care in this situation? A, ask the resident if they need anything else. B, only assist with toileting, then leave. C, provide oral care first. Or D, return later to make the bed. And if you were here for the first part of the video, cluster care is when we do as many tasks as we can at one time. So we don't have to keep entering and leaving a supply room, a patient's room. So with that thought in mind, I hope that you chose A. Cluster care means combining tasks. And so while you're in the room, you're going to ask, especially before you leave, is there anything else that I can do for you, so that you don't have to immediately return back to their room because they're asking for something else. Question 42. Which of the following is the best example of using cluster care during a busy morning shift? A, answering call lights as they come. B, bringing linens, fresh water, and hygiene supplies during your first visit. C, doing rounds every 2 hours. Or D, feeding all residents before assisting with hygiene. Right, revealing the correct response in 3, 2, and yes, it's B. Bring all the supplies in during your first visit. It's an efficient use of time and reduces repeated trips. Question 43. You're caring for a resident who needs a brief change, repositioning, and vital signs checked. What is the best use of time? A, perform tasks one at a time throughout the shift. B, do vital signs now and return later for the rest. C, complete all tasks during the one visit. Or D, let another CNA take over. So all of those skills that you learn in your CNA classes. I know sometimes students feel like it's a lot of skills. Oh, Nurse Eunice, we learned 25 skills. I have to remind them, you're going to be doing all that on your first day on the job during one shift. You're brushing teeth. You're giving baths. You're repositioning people. You're helping them with the bedpan. You're feeding patients who can't feed themselves. And so do as much as you can while you are in the room. So the correct response for 43 is going to be C. You're going to be grouping those care tasks together. But of the tasks that this patient required, which one would you do first? Would you change the diaper first? Would you reposition them first? Or would you check the vital signs first? And for anyone who said vital signs first, you are absolutely correct. So vital signs, diaper, I keep saying diaper, brief change. And when you're done changing their brief, once he's nice and clean, that is when you can reposition them. All right, question 44. A CNA is feeling overwhelmed after being assigned more residents than usual. She begins skipping small tasks and rushing through care. What is the most appropriate action? A, keep working and catch up later. B, ask the nurse for help prioritizing tasks and support. C, tell coworkers to do her least favorite assignments. D, call out for the rest of the week. You've had it up to here. Augusta says C and B. All right, everybody. You're going to get some help. It is going to be B. Ask for help. It's important to recognize the signs of being overwhelmed and seek support before your care starts to suffer. Asking for help shows professionalism and protects resident safety. Rushing or skipping tasks can lead to missed care and errors. And so those nurses who were arrested in Virginia, I think it was, they were falsely documenting that they were checking on a patient every 2 hours, etc. And so now they have felonies because of falsifying documentation, which led to a patient's death. So as a CNA, if you can't do those hourly rounds, don't document that you did them. You may lose a job, but at least you won't lose your freedom, and you won't lose, you won't lose your freedom. You'll just lose that job, and you probably won't lose your license either, because if they're not given enough staff where you can do your job adequately, if they're giving you 30 patients, there is no way you can do hourly rounds on 30 people. So I just want you to keep that in mind, because as a licensed professional, you also could not only lose your license, but you could be charged with abuse, neglect, and fraudulent practices if you're documenting that you're doing something. And in reality, they're going to check those cameras and they're going to see that for the last hour, you've not seen patient in room 102 once. So please don't document something that you're not actually doing. If you're overwhelmed, let somebody know. Question 45. A CNA is assigned to care for a resident with a new cough and shortness of breath. The resident is awaiting test results to rule out a contagious respiratory illness. The CNA has a newborn baby at home. What is the best action for a CNA to take before caring for her child after work? A, immediately hug and feed her baby without concern. B, call out of work until the resident's illness is confirmed. C, wait for the test results before deciding to go home. Or D, change clothes and bathe before holding her baby. All right, revealing the answer in 3, 2, and you got it right, you all. Protect yourself and protect your family. It is going to be D. This patient had a potentially contagious respiratory disorder, but what about the patients who have skin infections, who have scabies, who have body lice? I need for you, especially before you go and take care of your vulnerable family members, such as infants and elderly, before you get in that house and touch them, actually just take your shoes off at the door. Your shoes should not be walking through the house. And then take your uniform off, take a bath, and then you can go and love and hug on your family members. You're going to protect yourself too. Question 46. Which of the following scenarios reflects poor time management? A, planning your rounds and bringing needed supplies. B, skipping non-urgent tasks until emergencies are handled. C, walking to the supply closet 5 times during a single round or shift. D, using your downtime to prep for the next shift. So, which scenario reflects poor time management? Which CNA is just running around doing a whole bunch of, looks like she's doing a whole bunch of work, but not getting anything accomplished because she does not understand time management yet? And if you chose C, you are right. And then Miss Love, child of God, you're going to have to email me because I don't understand what you are not understanding on your test. And so when you email me, send me those results, and you can send an email to admin@fltraining.com. If you have English as a second language, sometimes you're not passing the test because of the language barrier. All right, question 47. And don't forget, you all, that you can take an audio test. Your test can be read to you. So you'll see the questions on the screen, and then, of course, your questions and answers will be read to you via an audio headpiece. And that would be a recommendation too, especially if you've taken the test twice and you've been unsuccessful. In most states, you only get 3 attempts before you have to go back to school. So question 47. The CNA is finishing their shift and still has to one, help one resident to bed, 2, complete documentation, 3, pass water to 2 rooms, and D, answer a call light. So you're finishing your shift and you still have these tasks. What task should be completed first? Documentation, water pass, assist the resident to bed, or answer the call light? What is your priority? You've worked a 12-hour shift. It is now 6:34. You're ready to go home, 6:34 p.m. And if you chose D, you are right. The call light may signal an urgent need, so that call light, the person who's calling, at least answer it to see what they need. And that's going to determine whether or not it is an urgent matter. Question 48. You are CNA assigned to assist in the emergency department. You just taken vital signs on 4 newly admitted patients. Which patient's condition should be reported to the nurse immediately? So as a patient care tech in a hospital, you can float to different units. So you can float to the emergency department. You're in the bay that has 4 patients. The nurse is not there. She stepped away to go draw some blood. So you need to let her know about which patient. Patient A has a temperature of 102.1, a pulse of 98, and a blood pressure of 122/84. Patient B has a respiratory rate of 12, her O2 sat is 94%, and her pulse is 64 beats per minute. Patient C has an O2 sat of 86% on room air, a respiratory rate is 28, and the pulse is 112 beats per minute. Or patient D, the blood pressure is 150/93, the pulse is 104, and the temperature is 99.4. Remember, all these patients have an acute medical issue. Otherwise, they would not be in the emergency department. But which of those vital signs are the worst? Which means that's the one you're telling the nurse about first. You'll tell the patient about all of them, but which is the first patient you're going to notify the nurse about? Revealing that answer in 3, 2, and all of you have it. It is C. So proud of you. So the patient's oxygen saturation of 86%, oh, that is low. And on top of that, the patient's breathing fast. So that's going to be the patient that you tell the nurse about first. Then you can tell the nurse about the patient who has the elevated blood pressure. But this patient is in, close to being in respiratory failure. So this is the one that you're going to alert the nurse about first. Remember, the nurse is moving. She's busy. She has labs. She's on the phone. She has to deal with family members. And so if you see something, you need to say something. Don't assume that the nurse is already aware. Question 49. You're assisting with 4 patients in the emergency department. Which of the following patients needs to be reported to the nurse first? Patient A is confused and disoriented with a blood sugar of 42. Patient B is shortness of breath, O2 set of 93, respiratory rate of 24. Patient C complains of headache, blood pressure of 140/90, pulse of 96. And patient D is nauseated and pale. They have a temperature of 100.4, but the blood pressure is 112/70. I will accept 2 answers for this one, but you're going to tell me about all 4. But which one should I go see first? That's the first one you're going to lead with, because that's how you prioritize care. You help me prioritize care by knowing which vital signs to tell me first. In 3, 2, and yes, that person with that low blood sugar. So you all, patient with a blood sugar of 42, that's real close to 0. So usually like our blood sugars above 80. So you can tell me about the person who has a breathing problem next, but tell me about the person with the low blood glucose level first. So it's dangerously low and can lead to seizures or unconsciousness because this patient is hypoglycemic. They have low blood sugar levels. All right, so everybody, we're on our last question. I thank you for staying for the whole video. I hope you learned a lot. So our last question is, a CNA student says, I'm really struggling to study for the CNA exam. Do you know where I can find some free or low-cost resources to prepare me? And here are your responses. Yes, you can visit fltraining.com for free practice tests and study guides. You can subscribe to Florida Training Academy's YouTube channel for CNA tips and video tutorials. C, you can check out Nurse Eunice's new CNA Exam Prep podcast so you can study on the go. Or D, all of the above. Revealing the answer in 3, 2, and get as many free resources as you need to pass this test. I just had someone contact me from Wisconsin, and they said the first time they passed their test, the first time they took their test, they did not pass the written portion. But the second time after they had started looking at my videos, the retest was so much easier and they were able to pass their test. So congratulations to that student and to the others who have passed their examinations. For those who have not yet passed your CNA exam, do not give up. Remember, you just telling me that you didn't pass isn't sufficient, because when you don't pass, they give you a printout and it tells you what you need to focus on. So make sure you focus on those topics. And a lot of you all have literally gone to CNA school and you sat in the class. So you have a face-to-face instructor. Meet with that instructor and ask for additional resources. But if you don't read, if you don't learn terminology, you're not going to be successful with the CNA test. And as we say in all of our videos now, a great, caring, and compassionate CNA is going to make a great, caring, and compassionate nurse. So I need you to learn all the terms that you can, because it's going to make it easier for you to get accepted into nursing school. And so everybody, we have our last slide here. I want to thank you all for watching today, and I do apologize for the technical issues and for my voice because I have a cold. But as soon as I get off, I'm going to go pick up my medicine and try to rest my voice. Miss Nurse Jackie will be on Monday at 7:30 p.m. with a new CNA practice test, and I will be on Wednesday with a phlebotomy practice test, because we've had a student who's requested that multiple times. So everybody, have a wonderful weekend, and I'll see you in the next video. I will hang around to answer questions in the chat.